at Belglade Elementary School.
Thank you very much. Very happy to be here. As the lead agency, the mayor mentioned, it is my pleasure to give advice to our incident command structure here at the E.O.C. We're trying to speak with one voice, and that's very important so that our citizens are receiving the same message and a consistent message. The Florida Department of Health's most important objective since this began is to decrease the impact of the coronavirus by using one very important epidemiological process, and that's called social distancing. I have a curve over here to help illustrate what I'm talking about. In any natural epidemiological event, you have a curve that, if it's left untouched, will go up very quickly and then start coming down over a period of time. That might be 1 year, it might be 3 years, like it was for H1N1 in 2009. What we try to do as part of public health and prevention is to move the curve to the right by giving us a time to prepare. And we try to decrease the impact of the lives of people that will be lost and the number of people that will be affected by it by social distancing. That's why you keep hearing the message of washing your hands and so forth. So this is a proven method and most importantly in this case, because this virus has no antivirals and it has no vaccine. The testing will only tell you whether or not you're positive, but the things that you have to do remain exactly the same, whether you know that you have the virus or that you're just simply sick. So let me get to what we can do in terms of social distancing. That means that everybody needs to be washing their hands, covering their cough, not going to work or to church or to social events or travel if you are sick. Why? Because no matter what you're sick with, you're going to make other people sick. Even if you just have the common cold and you're making somebody sick, they're going to be worrying and concerned whether or not they have this virus. We also want people to make sure that they're not going to the hospital unless you need emergency care. That is something that everybody knows. Hospitals are there for emergency care. The ER is for critical people. If we tie up the emergency rooms with people that want to get tested, then we're creating a huge bottleneck for that person. And it may be your grandmother, it may be your neighbor that needs an emergency procedure. Okay? So the hospital should not be used for non-critical individuals. The other part is, who are you going to call for information? Right now, we are clogging up many of our calls going to the health department. We want the health department to be available to talk to the hospitals, to the doctors, and to the other providers that need our guidance in terms of how they're treating their patients. For general questions, please, the public, call 866-779-6121. You can also go to the CDC webpage. They have probably every question that you have asked already answered for you there. The more you help us to get the information, the more we can do the important work of communicating with our providers and the people that really need our guidance. If you're sick, you need to call your doctor. Your doctor then will call us if they need help in terms of telling whether or not they need to be tested. We want to make testing more available. We know right now there's some bottlenecks. With this state of emergency, this will give us the opportunity to work with our providers here in town and increase the availability of that testing process. Let me explain something because people are a little confused. There's two parts to the testing. The one test is when you go to see your doctor, that he takes a long Q-tip and he does a swab of your nose and your throat. He should also be testing you for the flu virus, the flu A or flu B, and any other condition. You may simply have a common cold. The need to explain whether or not you traveled is not necessary anymore because we know we have person-to-person transmission and you're going to get it from somebody who has not traveled or you have not traveled. So that requirement is gone in terms of the testing. So after they do the swab of your nose and the swab of your throat, then they put that little Q-tip or little long Q-tip into a test tube that has liquid on the bottom of it. That's called medium. So that test tube then gets sealed, it gets packaged, and it goes to a lab to get processed. They use the test kits that you've been hearing about going to the labs to then test that sample that was given to them by the doctor. Okay? We do not have a lack of test kits. What we have is lack of people being able to do that swab in order to get it to the labs to be tested. So the Medical Society has a program put together where Dr. Bush and Dr. Bush is an infectious disease physician, and we're going to be talking to the providers so that we can get more providers to do these tests so that they can get into the labs to be processed. So with the state of emergency, this is going to give us that ability to try to improve that, and we hope that that will be getting better and better as it goes along. So I'm going to stop there and allow the other folks to speak and share any other information, and then we're going to open it up for questions, I believe. Is that correct?
Yes.
Okay.
Thank you, Doctor.
Is this all my stuff?
Don't take off.
Oh.
Again.
I did it.
Thank you, Dr. Alonzo. We're now going to welcome remarks by our County Sheriff, Sheriff Rick Bradshaw. Thank you, sir.
Thank you, Mayor. I just wanted to clear up some points, make it crystal clear to everybody, because we've had some phone calls about, what are you going to do with this? What are you going to do with that? One of the things I want everybody to be very, very clear on is if the health department says to you self-quarantine or you get served with a confinement notice, this is not a casual request, folks. The sheriff's office is fully capable of enforcing these orders from the health department. And trust me, you want to stay in your residence, you do not want to stay in my hotel. It's much more comfortable at home. So take these orders very seriously. We've also had some phone calls from people saying, well, what about people getting out of jail? How do we know they're okay? Nobody's going to come into our jail that we believe is infected. We screen everybody that's arrested before they come into the jail. So if somebody's released, it's not going to be an issue. All right, so don't worry about that. And the last thing, excuse me, I see my partner here, the state attorney. He's going to talk to you, I'm sure, about price gouging out there. So there's some phone numbers to call, but I'll let him cover that. Thank you.
Thank you, Sheriff. At this time, it's my pleasure to welcome to the podium Palm Beach County Fire Rescue Chief Reginald Dern. Thank you, sir, for joining us today.
Thank you, Mayor. I first want to tell everyone that Palm Beach County Fire Rescue has been preparing for this specific event for 2 months now, as well as continually training on how to mitigate circumstances that involve viruses of this effect. So I want to instill a sense of calmness. I also want to let you know that what we've done is we've modified our dispatching questions to ask more questions specific to ascertain whether or not individuals could possibly have been exposed to or been in a circumstance where they may have COVID-19. While this questioning is going on, I want you to know the dispatcher is still responding, still dispatching units to the scene, same responses we've always had, equaling the same rapid response times. Once units arrive on the scene, if it is indeed a situation where they suspect someone may have been involved in COVID-19, whether a positive test or potentially as such, we're going to limit the number of personnel that enter into the area where that person is. So that means one person will be suited up in a rather unique outfit that you probably don't see very often, but it's for the protection of you as well as our personnel. Indeed, if indeed we do transport someone, again, we're going to limit to the exposure of our personnel to that individual in the back of the rescue unit, but we will certainly be doing everything we can to provide them the care they need. I want to emphasize that our purpose is for emergency care. I think, as Dr. Alonso has stated, that by and large, individuals who are exposed to COVID or who might have some symptoms of COVID-19 don't necessarily require an emergency transport, that much of this can be handled through local physicians. I also want you all to know, please, we're going to continue to prepare. We're going to continue to get better. We've been through events such as in the past, and we'll get through this one. And I want to say once again, the men of Palm Beach County Fire Rescue, men and women, are definitely prepared to take care of the situation as it presents itself. Thank you.
Thank you, Chief. All right, so the questions that I get most by text, email, phone call deal with our children, of course, and our public school system. So it is my deep pleasure to invite to the podium the Superintendent of Palm Beach County Schools, Dr. Donald Fenoy. Thank you, sir.
Thank you. Good afternoon. Today, after continued collaboration with county officials, the Florida Department of Health, my executive team, we made the difficult decision to close schools effective Monday, March 16th. Aftercare is still scheduled for today, so are extracurricular activities. Also, very important, the SAT will be given on Saturday. Next week was already an abbreviated week as Tuesday is primary day, and schools were previously scheduled to be closed for voting. Students are off for the next 2 weeks. Now, let's talk about employees. As the largest employer in Palm Beach County, I'm sure this is very important to folks. District offices will remain open. All 12-month employees and school food service managers will continue to work during this period. Teachers and all other support staff are not to report to work effective Monday, March 16th until further notice. Voting will still take place Tuesday at the schools previously identified as polling places. The decision to close schools aligns with the state of emergency declared by the county. Being closed next week will also give the district time to evaluate and fine-tune our remote digital learning opportunities for our students, should that become necessary. My plan today is to close schools at least through the last day of spring break, which is Friday, March 27th. Over the next 2 weeks, we evaluate that timeline and decide if it is in our best interest to extend that date. As you may know, I previously canceled international and out-of-state travel. Today, I also canceled in-state travel until further notice. It is important for you to be aware that I have instructed the district's food services department to make meals available to families who need it. My staff has been planning for that event, in case I made that decision. This is a rapidly evolving situation, and it is important to understand that my first concern is with the health and welfare of our students and our staff. Canceling school is the first step to ensuring that. All of the other details will be worked out in a timely fashion. I also would like to remind everyone the district has dedicated coronavirus website at palmbeachschools.org/coronavirus. We're also operating a coronavirus hotline for school-related questions. The call center is open Monday through Friday from 8 a.m. to 4 p.m. The number for that hotline is 561-969-5840. Representatives are available in English, Spanish, and Haitian Creole. I understand that closing schools will be a burden on many families. I don't take this lightly. I am the superintendent, but I'm also the father of a 4-year-old who goes to daycare. So I have to decide over the weekend how we will deal with this. So I understand and empathize with all families impacted. And those are my comments at this time. Thank you.
And just one other quick comment, because Dr. Fenoy and I talked about this. This is the message to the parents. Keep control of your kids, please. They're going to be out for 2 weeks. We all know what happens when the summer break comes. Issues start popping up, all right? So we don't want a bunch of people just wandering around out here aimlessly with nothing to do. So parents, keep control of your kids, know where they're at and what they're doing, please.
Thank you, Sheriff. All right, I'm now going to turn it over to our Director of Airports, Laura Beebe. I know that our airport, in particular Palm Beach International, has been the center of some concern for reasons unrelated to anything that we could have done, but I'm sure you're going to address and update the community on that. Thank you.
Good afternoon. We have received a lot of questions about the incident on Wednesday, so I'm going to go through a timeline, give you a little bit of information. On Wednesday, March 11th, at approximately 8:35 p.m., PBI was notified that a passenger on a JetBlue flight from JFK had tested positive for COVID-19, resulting in the activation of our emergency procedures. All appropriate authorities were immediately notified, including the Palm Beach County Health Department and Palm Beach County Fire Rescue. Although JetBlue flights typically deplane on Concourse C, the aircraft was repositioned to Concourse A for the safety of our passengers and to allow the continued operations of the airport, because this area is isolated from the remainder of the terminal facilities. Concourse A was closed to the public prior to the deplaning of the passengers and will remain closed until Sunday morning. The concourse has been thoroughly cleaned and disinfected in accordance with Health Department and CDC guidelines. No other airport facilities were impacted by the incident, and our operations remain normal at this time. We strategically placed signage in high-traffic areas and have increased our cleaning protocols, focusing on high-touch areas such as handrails, elevators, escalators, and bathroom facilities. We've established a COVID-19 page on our website, pbia.org, which links to a COVID-19 resources page for our customers who may have general questions regarding COVID-19, and links to the latest information on airline advisories and important notices. Passengers are strongly encouraged to check with their airline for the latest travel and flight advisories. Contact information for the airlines is also available on our website. Passengers with concerns regarding travel associated with their personal medical or health conditions are encouraged to contact their healthcare providers prior to travel. Those are not questions that we can answer. We are not healthcare providers. Passengers are also encouraged to follow all CDC recommendations to prevent the spread of this illness, including frequent hand washing. Finally, I'd like to assure the public that we're in constant communication with our local, state, and federal partners, as well as our airline partners, regarding the evolving situation, and the safety of our passengers and our employees is our primary concern. Thank you.
Thank you, Laura. We have two more important speakers, and then we're going to open it up to questions. I'd like to now invite our state attorney, Dave Ehrenberg, to the podium to speak about some of the court processes and prosecution issues. Before he speaks, I do want to say that I had the opportunity to speak with the Chief Judge of our Judicial Circuit, Chief Judge Krista Marks. She will be issuing some administrative orders pertaining to jury duty and services and access to courts issues, and those will be disseminated directly from the Chief Judge's office. I now present Dave Ehrenberg, our State Attorney. Thank you, sir.
Thank you, Mr. Mayor. I am Dave Ehrenberg, State Attorney for Palm Beach County. I've been in touch with the Chief Judge. We are waiting on a directive from the Chief Justice of the Florida Supreme Court to determine what next steps are to be taken when it comes to the criminal side of the courthouse. Our office, the State Attorney's Office, is currently running as usual, and we expect the statement to come from the Chief Justice sometime today. So we're anticipating that today. But as far as other things, the Sheriff is right. If you commit a certain number of crimes, a robbery or burglary during a time of emergency, not only will you see the Sheriff and you'll have an expedited review for any crimes related to COVID-19 during this time of emergency, but also you're subject to a potential enhancer. So if you commit a robbery, like looting, during this time of emergency, it could be upgraded from a third-degree felony to a second-degree felony, a second-degree felony to a first-degree felony. So don't even think about it. And as far as price gouging, we've heard a bunch of complaints of people who cannot find hand sanitizer, who cannot find toilet paper. I still don't understand the run on toilet paper during this time. But as far as the jacking up of prices, such as you've seen this online and perhaps in the brick and mortar stores, if you grossly inflate the price of certain commodities like hand sanitizer during this time of emergency, then that's price gouging. And if you see price gouging in effect, please report it to the Florida Attorney General's office. The hotline is 1-866-9-NO-SCAM. That's 1-866-9-NO-SCAM. There's also a website. You can find it at the Attorney General's office's website online. There's a link there to report price gouging. And finally, we've been through hurricanes together. We've gotten through it. Let's keep being good neighbors, and we'll get through this too. Thank you.
Thank you, Mr. Ehrenberg. And our last speaker is going to be our County Administrator, Virginia Baker, and I want to point out that this declaration of emergency designates and delegates a lot of the Board of County Commissioners' authority in terms of contracting, appropriations, and things of that nature directly to our county administrator. She's the incident commander of the county, and she's been delegated proper authority to react effectively to the state of emergency. After she's done, I'll have very brief comments, and we'll open it up to questions. Ma'am.
Thank you, sir. Good afternoon. First of all, let me thank you for being here because you are our median to making sure that our residents in Palm Beach County is receiving adequate information and timely information. So thank you very much. Palm Beach County has been definitely working with our community partners, and you see a lot of them standing behind us. We are in constant contact with each other, and Dr. Alonzo is definitely our medical liaison when it comes to communicable disease disasters, and so we have been relying very heavily on her. But we've also been working with other community partners, the medical society, the hospitals, et cetera, and we will continue to work with them in order to get us through this particular process. Palm Beach County government will implement further actions as far as county buildings and activities are concerned. County staff has begun enhanced cleaning protocols in all of our county buildings to ensure that they are safe for county staff as well as the public. As of today, all county libraries and county facilities will remain open. However, we will, in abundance of caution and in compliance with federal and state recommendations, we will be canceling all county-sponsored non-critical group meetings, including advisory board meetings, training sessions, seminars, presentations scheduled to occur within the next 30 days. Meetings, however, meetings and hearings required by law will remain scheduled and take the necessary actions. We will require that our staff who staffs these particular boards will take into consideration social distancing, as the doctor referred to earlier, and other preventive measures that will be implemented to keep us all safe. As conditions change, we will continue to release that information to the public and hopefully through you as our partners, the press. I do want to share with you that elections will occur. So next Tuesday we will be voting. However, I want to remind you that early voting is occurring as we speak, and that will be through March 15th. The hours between now and March 15th will be 10 a.m. to 7 p.m. And then you will go to your assigned polling places if you do not vote early. I do encourage you to take advantage of the early voting. Last but not least is Census 2020. With all of this going on, I need to remind you that in the next day or so, if you haven't already begun to receive notices from the U.S. Census Bureau, please adhere to responding back to the Census Bureau letter. There is a number assigned to the address in which the letter was sent. You need to go online and address that, answer all of the questions that they may have. They're going to send this letter out. We're going to push, and I need your help to push because every living, breathing soul in Palm Beach County needs to be accounted for. And so we're going to rely on you, media, along with all of the people that are listening to us today. Please fill out these forms. If your residence has not come back through the U.S. Bureau of Census as responding, then after April 1st is when the U.S. Census will start to make contact with that household. So as I've said to people, if you don't want the U.S. Bureau to knock on your door, please fill out the forms. For those individuals that do not have access to computers, the county's libraries branches will be open, including the main library, so that you can go in and fill out the census forms. So if you have any further questions on the census or the elections, please do not hesitate to contact the county. Thank you.
Additionally, the Supervisor of Elections, Wendy Sartori Link, can be of assistance, and you can find that number online. I'm joined to my left and your right by the Vice Mayor of Palm Beach County, Robert Weinroth, and on my right to your left, County Commissioner Melissa McKinley, who has previously served as County Mayor. Would either one of you like to make any comments to your constituents? We thank you for being here. The entire Board of County Commissioners we are here at the Emergency Operations Center right now in this press briefing, and your elected leaders will continue to be here and be of assistance to operational leaders that are standing behind me. I want to reiterate two things before we turn it over to questions. And I would ask that if a question's been answered already, please don't re-ask it. Everyone standing behind me has an operational role in this declaration of emergency, and they need to get back to work. But the first one is that this written order declaring a state of emergency in Palm Beach County wasn't designed to make you rush out and buy more toilet paper, okay? It was designed to push that bell curve that Dr. Alonso spoke about further to the right, because we have a vital role in reducing the spread of this communicable disease. For example, if you are feeling sick, whether you suspect it's coronavirus or not, you should not be getting on an airplane and traveling somewhere. I can't stress that enough. The diligence that we take as members of our community is vital to pushing that bell curve farther to the right, which means less loss of life and less discomfort in our community. With that said, we'll take questions now, and I'll try to play air traffic controller here to make it as efficient as possible. Mr. Washington.
Yes, this is a question I'm hoping Mr. Ehrenberg or the sheriff could answer. Has there been any consideration of any type of public endangerment charge for the individual who, while awaiting test results, gets on a plane and possibly endangers the health of a plane load of people coming to our county?
Yeah, I can definitely assure you that we've looked into this. The state attorney can answer you a little bit more because he's researched it, but we've contacted him and federal authorities to see if, in fact, there's some charge that could be lodged against him in this particular manner. But as of right now, it's still in the research phase.
Yeah, and thank you, Sheriff. And we are giving anything that's COVID-19 related that comes into our office expedited review. Without getting into specific facts of any potential case, I could say there may be a need for the Florida legislature to address a situation like this to make sure our laws are modernized to affect a pandemic and future pandemics.
Yes, sir.
This is for the school superintendent. FSAs are around the corner. How will this affect FSA scheduling and so forth?
So it absolutely will affect it, considering that we actually don't know when we're going back to school. So the date that I gave is tentative, obviously, as things evolve. I'm more than certain that the Commissioner of Education and the Governor's Office will be reviewing all of these circumstances and realities as we move further into the month.
And the second part, children, many children of our community, they have 2 meals a day thanks to the school system. Will they be able to go for breakfast and lunch to have breakfast and lunch?
So right now the team has definitely been preparing for that reality. Different than a hurricane, now we have to figure out how to reach all of those children. So part of the decision to close schools is so that staff can have kids at home so we can figure out all of those logistical pieces moving forward.
When can they expect though that hot meal?
Excuse me?
When can they start expecting, since schools are closed starting Monday, can they still though go on Monday and receive a hot meal, or when will that be?
We will communicate all of those things because, again, when we close school on Monday, we need the weekend to figure out where that could even be at. So there's a lot to consider. Our district, our communication specialist has created a timeline, so we're communicating every single day. So we would ask parents to refer to our websites and hotlines every single day, and we'll get them the most accurate information.
Thank you.
Yes, sir.
This is for the health department.
Yes.
We're seeing, we're hearing from a number of people who either A, don't have access to a primary care physician, or B, can't get through their primary care physician, or are just visiting and don't have one, and they feel symptomatic and they're frustrated that they can't get a test. What can be done for those people?
There are several avenues. There's walk-in clinics where they can actually talk to a provider and have those decisions made. For people who go to federally qualified health centers, those are specific clinics that are here in town. Those people are available, those providers are available. But my key point that I want to keep making is that you need to talk to a physician, you need to talk to a provider. And we also have free clinics that are available in the community, so there are many, many places. And again, we're going to be, with this declaration of the emergency, we're going to be talking to all those providers, as many as we can, to make sure that they increase their ability to do those swabs and get those things done, so that we're not burdening the hospitals and the people that need to be working on the emergencies.
Why send people through a primary care physician? Is it because that there are just not enough tests to meet demand and you've got to call through this?
No, it's not. It has nothing to do with the testing. It has to do that only a physician can say, for example, one of the things that puts you at a higher risk is your comorbidities. When you call up to an epidemiologist, we don't have any of that information. So the first thing we ask is, we need to talk to your provider. So it's good medicine to do it that way. And it's the only way that we can get all those additional factors, that we're flying blind if we're just trying to treat people like a machine. So medicine is very complicated. Everybody can't get the same answer for these things. So your medical provider is critical in this information. Next question.
Dr. Alonso, we're hearing from some folks, and forgive me if you hadn't answered this already, but a lot of people wanted to know, and it pertains to this curve, why the people on that aircraft were set out into our community, and what is the risk right now? Because we're also getting questions of, is it safe to go to the store? Is it safe to go out to eat? Because there's confusion about whether this is airborne or on surfaces.
Okay, it is completely safe, and we would not put anybody out into the community if it was going to cause more harm. So, of course, that answer is understood. We followed the exact guidelines. We know that people are going to be flying. We know that people may become sick, and we were not expecting people to be flying, but we know that that could happen. So again, in all these emergencies, we plan for the worst, hope for the best. So we were hoping that people wouldn't do it, but we certainly planned for it. And that's why Laura mentioned all the guidelines that we have. So those people were treated exactly the way with the protocol. The protocol for an airline is very different from the ships. Okay, we're not going to fly people around for 3 weeks and then land them off back where they belong. So with an airplane, what we do is we look at 2 rows behind the person, 2 rows in front of the person, 2 rows to either side. And that's exactly what we did. I personally saw every single person in that airplane. I interviewed and examined the passenger that was ill. He had no symptoms. The passenger had no symptoms at all. The passenger was afebrile. So all these things are taken into consideration. Everybody who is positive is going to be quarantined. That means you're going to stay in your house, in your home, or wherever your destination is for the number of days that we recommend. The number of days depend on when you had symptoms. So he was appropriately sent to his home. The people surrounding him were appropriately told to monitor for any symptoms. That's exactly what we did. And the rest of the people that were not in that vicinity of the passenger were then released from the airplane and sent home. And I spoke to each one of them. I answered all the questions that they had. Most people, despite this being a horrific, scary situation, were very grateful and accepted the fact that they know this is going to happen. This is going to happen in other places. This just happened here, so it's very local. So the question also in terms of the crew, that's the other group that we identified. I spoke to all the crew. They're also followed by the quarantine station, and all those guidelines were followed to a T. Next question.
How long will that passenger be quarantined for?
The passenger, 14 days from the day that he had the symptoms, and that's been instructed, and they've been following the guidelines strictly.
So that would be until when? Do you know?
14 days from that time. I don't have.
And do you have any more information about the 2 new cases in Palm Beach County, when they were
Sure.
tested?
Let me read that to you. The 2 new cases that we have is a 73-year-old male in Palm Beach County. He was tested positive for COVID-19. This individual is isolated and will continue to remain isolated until cleared by the public officials. This is a travel-related case associated with the Nile River Cruise tour in Egypt. The second person is a 74-year-old male in Palm Beach County who was tested positive. This individual is also isolated, will continue to do so, and this is a travel-related case associated with travel to Europe. By the way, talking about the travel to Europe, please continue to see the CDC guidelines for what is a level 3 and what is a level 2. Those changed. Level 3 now does not only include the 4 countries of China, Iran, South Korea, and Italy. Now it includes almost all of Europe. So go on that website. If you are traveling and you come from any of those countries that are in level 3, now you have to stay home for 14 days after you come back. Very important that people get that message.
Follow up on that. Is it your belief right now that the only cases that turn up in this county are travel related and not community based?
No, not at all. Where'd you get that? What did I say to make you think that?
It was travel related, and then we had
these two happen to be travel related.
Okay.
Yes.
Doctor, you've had some world leaders potentially exposed to the coronavirus at Mar-a-Lago. Has anybody at Mar-a-Lago reached out to you? Are you advising them? And would you recommend that they close and not continue to host people for the foreseeable future?
We are aware of anybody that we need to take care of. That all goes through again, it doesn't matter if they're in Mar-a-Lago or they're at the discotheque on the corner. The procedure's the same for everybody. It gets handled through the state and through the CDC and through the federal. So everybody's treated the same.
So are you speaking to them? Anybody at Mar-a-Lago?
I'm not speaking directly to them. We have no reason to be speaking to anybody there because we don't have any issues with the problems there at Mar-a-Lago at this time.
Doctor, I'm piggybacking off the question over there. Is there a potential that there are cases in the county that have yet to be tested, potential cases in the county because there is some kind of a backlog in the testing procedure?
Has nothing to do with the backlog. I imagine that most people, probably 99% of the people that get this disease, won't even go to their doctor. They're simply going to think they have a cold and resolve from it. So there'll be plenty of people that won't get tested. And again, ask yourself, why are you going to get tested? You're going to act exactly the same whether or not you have this.
So
okay?
the
It has nothing to do with the availability of tests.
But
I want to be able to get everybody a chance. Go ahead.
So we're getting calls from elderly who have to renew their driver's license and can't do it online. Is there any provision been made for that? IDs?
I'm not going to answer that one. That's definitely not medical.
That's a state.
Yeah.
That's a state deal.
Doctor, one follow-up.
Okay, so we're going to move on. We have a time frame here, and so if there aren't any other questions, we'll take a couple more. Yes, sir.
If Dr. Alonso would be so kind and very briefly, in Spanish, explain that chart for our Hispanic
And then we'll get to you, I
audience.
promise. Yes, ma'am.
Gracias. Trataré de hablar en español correcto. Si mi mamá no me está mirando, me va a matar cuando llegue a la casa. Este diagrama lo que enseña es la curva normal de una epidemia. Sube rápido y entonces empieza a bajar. Ese tiempo puede demorarse 1 año, a veces 3 años. Lo que nosotros estamos tratando de hacer con la ciencia de epidemiología es mover esa curva para la derecha, para que haya menos personas afectadas, menos personas que mueren y demorar el tiempo que tenemos para parar. Eso es básicamente la ciencia de lo que nosotros le decimos en inglés social distancing. O sea que las personas tienen que estar lejos de las personas que están enfermas. Y tienen que lavarse las manos, no ir a lugares públicos si están enfermos, si tienen fiebre, no vayan a la iglesia, no vayan al trabajo, porque entonces van a infectar más personas. Y también no vayan a lugares donde hay mucha gente público, porque entonces se van a enfermar las personas alrededor de ustedes. Gracias.
All right, we're going to take one more question. Yes, ma'am.
Could you explain, Dr. Alonso, a little more about, you've said that there isn't a shortage of test products, but a shortage of people doing the swabbing. Can you explain that a little more? Who needs to be doing the swabbing? What are you and Dr. Bush going to do?
What we're going to try to do is to get the providers to do that swabbing in their office so that then they can take that swab with the medium and send it to the labs who have the test kits for testing that material that's in that medium.
So why is that not happening now?
For various reasons. Maybe they think they don't have to do it, or they have not collected, they don't do it in their office. There could be probably, if you talk to the doctors why they're not doing it, you might get the answer to that.
I'm not getting any answers, but have you had anyone a doctor who said, I want a certain patient tested and the test wasn't available?
We have not had that situation. That's why I keep saying in Palm Beach County we've been very organized. We've been able to do this quite efficiently. We have even we had somebody who needed the test picked up. We have picked up the test in the early beginning ourselves to make sure that they get to the Miami lab. We have shipped, before we had the Miami lab available, we were shipping these things to the CDC. And so we have had no problem with that in Palm Beach County. I cannot talk for the entire state, of course, nor for other states. Thank you.
Thank you. We're nearing the end of the press conference. I do want to invite the county administrator to come up for a clarification, and then I have one more comment regarding to the driver's license issue, and then we'll adjourn.
Moving really fast, and what I want to do is correct the early voting time, and that is from 10 a.m. to 6 p.m. as opposed to 7 p.m. It is 10 a.m. to 6 p.m. Thank you.
And now we'll have Commissioner Melissa McKinley to make some brief comments as well.
Just a real quick follow-up to the gentleman's question over here about access to healthcare providers. I would encourage anybody who's got health insurance through their employer to look for their telehealth benefits. Many different companies and employers offer that. I do know that there are healthcare organizations in our community, Baptist South Florida being one of those, that is providing a mechanism to have your first telehealth consultation with a doctor provided free of charge. And so look around over the internet and online for those types of resources that are readily available. Thanks.
All right. With regards to the driver's license issue, again, I want to caution the vulnerable population about going out into public unnecessarily into an area where there may be a lot of people, like the driver's license office. But if they feel that it's necessary, that's handled by the Palm Beach County tax collector, and that phone number is, well, I just had it. Now it won't let me do it. Let's see, 355. Well, let's see what happens here. I'm gonna call them. 355-2264. Yes, ma'am.
Being told when they call just to come down.
Well, you know, it's definitely a dynamic process. I think every day later is a day deeper into this process. So if they feel that it's necessary, they need to either try to renew online or they need to make a personal decision to go into a government office building. Our government buildings are still open. That may change in the near future. And then second of all, with regards to, there was an issue of voting, Vice Mayor Weinroth reminded me that we're both in a presidential primary and municipal elections. Polling places on the date of the election may change, so I would encourage you to go to pbcelections.org. pbcelections.org. This press conference is about our civic duty of not spreading this virus. That doesn't mean that our civic duty of voting goes away. So if you're interested in voting, I've already voted by absentee ballot, or vote by mail is what we're calling it now. So if you haven't voted, try to do it earlier rather than later. We're in an early vote period where there's no crowds at early voting. I promise you, I drive by every day. There's no one there. You can get in and get out. The last point that I wanted to make is that this declaration of emergency is for 7 days. It's restricted by law, begins at 2 p.m. today, and will extend for 7 days. And then, obviously, we're going to have to readdress this issue and either extend the order or not. So we will be in constant communication with the members of the press, our constituents. I appreciate the press's role in communicating these issues to the